What are the signs of a chemical pregnancy? Imagine feeling hopeful about pregnancy, only to find out your body is going through something different. That's often what a chemical pregnancy is. It happens very early, usually before 5 or 6 weeks. Many women don't even realize it's happened because it's so quick. A key sign is a positive pregnancy test that then turns negative within a few days or weeks. You might see a faint line at first, but then it disappears. This can be confusing, especially if you're tracking your fertility. Sometimes, women notice vaginal bleeding that's heavier than a typical period or has mild spotting about a week before their expected period. The bleeding can feel similar to a period but might be slightly heavier or lighter. Cramping is another sign. It's usually mild and less intense than menstrual cramps. You might feel a dull ache or slight discomfort in your lower abdomen. If you're paying close attention, you may notice that early pregnancy symptoms like nausea, fatigue, or breast tenderness are missing. This absence can be a clue that something isn't progressing as expected. Blood tests can reveal low or declining levels of human chorionic gonadotropin, the hormone that supports early pregnancy. If you take a blood test and see that your levels are dropping, it's often a sign that the pregnancy isn't developing. Because chemical pregnancies happen so early, many women don't realize they've experienced one. They might mistake the bleeding for a normal period or not notice any symptoms at all. If you're trying to conceive and notice these signs, it's reassuring to know that chemical pregnancies are common and usually not a sign of long-term fertility issues. If you experience multiple chemical pregnancies, it's a good idea to talk to a healthcare provider. They can help identify any underlying causes and guide you on next steps. Understanding these early signs can help you manage expectations and stay positive during your fertility journey. In summary, watch for a positive pregnancy test that turns negative, unusual bleeding or spotting, mild cramping, and the absence of typical pregnancy symptoms. If you notice these signs, it's helpful to consult your doctor for further guidance. Recognizing early pregnancy signs can make your path to conception clearer and less stressful.